Hello, everybody. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Cachoa with PAR5 Physical Therapy here in Randolph, and I've partnered with them to bring you an easy and educational workday session. Today's session is injury prevention in pickleball. A little bit about me. I got my doctorate in physical therapy in 2010 from Mercy College. Got an undergraduate degree in exercise science from Rutgers University. I'm a board certified orthopedic clinical specialist, certified golf medical professional, certified golf fitness instructor, certified CrossFit level 1 coach, and certified dry needling specialist. So a little bit about today, we're going to be talking about common injuries in pickleball, how to do some strengthening and stretching exercises to reduce your risk of injuries in the court, and hopefully make your next time on the court more productive so that you can win points and feel better, move better, and play better. All right, so let's do our little slides. I pull this up here. So here we are, injury prevention in pickleball. All right. So because I'm a medical professional, I always have to put this slide up. You know, the stuff that we're going to be talking about is geared at a broad audience, a broad population. If you're dealing with something specific, please go out, have a thorough physical examination so that you can have all the root causes and associated factors all treated successfully, because the stuff that we're going to be going over is general advice. It's not physical therapy. It's not medical advice. All right. Now, if you've been to any of my other classes or seen me before online, I always put up this next slide because it summarizes everything, sort of everything we know musculoskeletally about the human body. The body functions on this alternating pattern of stability and mobility. If this pattern is disrupted, then pain or injury is a result. So if we look at from the ground up, your foot needs to be stable. The next joint up needs to be the ankle mobile. Next joint, the knee needs to be stable. Next joint, hip needs to be mobile. Next one, lower back, T-spine, goes back and forth. This alternating pattern of stability and mobility, this is how we address pain points and how we treat pain or injuries. So if you're dealing with something like, say, the knee is supposed to be a stable segment. All it does is just straighten and bend. There's a little bit of rotation that happens, but we're mostly concerned about the ability for it to bend and straighten. Now, where we run into problems is that if there's a hip issue or an ankle problem, if the hip or the ankle aren't as mobile as they should be, then the body makes this compensation strategy and makes the knee unstable or mobile. It makes the stable segment mobile, and then we run into problems. And we'll talk more about that. These are the three things that I usually see people for in terms of pickleball injuries. You know, knee problems like patellar tendinosis or tendinitis, knee ligament tears or strains or sprains, and arthritis in knees. You know, those are very common for a lot of athletes. And then we go into the elbow tendinosis or lateral epicondylalgia or tennis elbow, whatever you want to call it. It's pain in the elbow. And then ankle sprains, another thing that we're common to see in pickleball, with all the lateral movement, cutting, quick motions, ankle sprains. It's basically an overstretch to the ankle ligaments. All right, so let's dive in to some of these points. The first one is patella issues, patella tendinosis. It's basically an irritation to this point here below the kneecap. That's the patella tendon. And with repetitive stress, when there's extra stress on that, those fibers of the tendon can become disorganized. They become inflamed initially, and we classify that as patellar tendinitis when there's inflammation involved. But that's only for 72 hours. After 72 hours, if the pain persists, like when you go back onto the court the next time and you still have knee issues, we call that a patella tendinosis. And what does that mean? That means that the fibers of that tendon, instead of being parallel to each other and organized, which allows the tension from the quad muscle to be transmitted effectively into the the knee into the shin bone, the disorganized pattern of the patellar tendon, that causes this inefficiency, and it makes it a little bit larger. So then we start to have pain when we put pressure on that leg or start to fire up that quad. And oftentimes, this can be due to tightness or over tightness in the thigh, the quad muscle, but also the hip flexor, which is a point right in front of the pocket of the hip flex, the hip that basically lifts the knee up. If that muscle is tight, that could also create tissue issues downstream into the patellar tendon. All right. The next one I have up here are the ligaments, the most common ligaments here from the front view. So you can see the kneecap here, and LCL, the lateral collateral ligament, the MCL, which is the medial collateral ligament, and then the ACL. I would say this in the past 5 years since I've been treating pickleballers here, it's not so much that we see tears, but we do see sprains or strains to these structures around the area where a ligament gets overstretched quickly and then there's pain in that area. All right, so it's a traumatic overstretching of ligaments, whether or not it's a partial tear or a full thickness tear or just an overstretching. It's basically treated the same way. If there is a complete tear though, and you have a lot of instability in that joint, then you might have to have surgery to have that repaired. All right. The next one commonly I see is knee arthritis or some type of degenerative changes that happens. You can see over here, this is like a normal knee, and the cartilage is nice and white. We usually don't see that type of white cartilage in anyone over 30. But anyway, the joint space is preserved. There's space in between the joints. And you can see how with degeneration that we lose that joint space. There's changes in the joint itself. We lose the cartilage. Now, when the body loses cartilage, that's that cushioning component of a joint, the body responds by growing more joint to protect the area. In response to protect the area, it grows more bone. So then we have these bone spurs, right? Where the joint starts to look and move differently. Now, this can often happen because of poor body mechanics. We mentioned earlier that the knee is a stable segment. All it likes to do is bend and straighten. Now, and I'll show this to you later, if that bending and straightening isn't exactly along the axis of the joint, maybe it's a little bit off axis, you're bending a little bit inward, then that creates excessive stress on the inside of the knee, and we get this right here. So the inside of the knee is this side of the knee, and you can see how there's a lot more wear and tear. There's a little bit more bone growth and bony spurs on the inside of the knee. Over here, this side right here, that's the inside, and that's the outside of the knee, lateral, medial. All right, so there's always a little bit less space on the medial side of knees because physically, that's where most of the weight is, on the inside of the joint versus on the outside. All right. So if we go to the elbow is very similar to the patella knee issue in that any pain on the outside of the elbow is typically due to the tendon where that muscle is attached to the outside of the elbow. Now, those muscles in the forearm, they basically control the fingers. So we have the fingers and the wrists, all those muscles that control that, they start all the way up here on the elbow. And if that is overused, we get the same type of effect with the knee thing, the knee patella issue, where those tendons, they get micro trauma, the fibers become disorganized. They might be like a linen shirt. I like to use the analogy of a linen shirt that's really wrinkled. You roll it up, you put it in your bag, and you leave it there for 2 days, and you take it out. It's like a big wrinkled mess. Normally, tendons should be organized and flat, like a brand new linen shirt, right? That's been ironed and nice and flat, right? Organized, so that it can create that tension that comes from the muscle directly into the bone, pain-free. The disorganized fibers are what basically cause the chronic conditions that we see that happen after that initial inflammatory effect has decreased. All right, and then we have ankle sprains. It's basically overstretching of the ligaments that hold the ankle together. So we have a inversion sprain at the top there. That's the most common one, where there's a trauma to the outside of the ankle. And less common is the eversion strain, that second picture. And then the least common, but still happens, is that high ankle sprain, where the tendons, the ligaments in between the two bones of the lower leg get sprained. All right. But what do we do? How do we treat all this? We go back to this. Injury prevention is all about making sure that each segment is fulfilling their role, that they're doing their job. Okay. If one of these segments is off, then we've got issues. All right. So a couple things that we're going to talk about right now are a hip hinge, a lunge, and proper body mechanics. Oh, you know what? Another thing that I want to mention about lateral elbow pain, that could also be due, because the implement of the racket or the paddle is in our hand, that could also be due to faulty grip, faulty hand position if the grip is too small, and also bad movement mechanics. Like, say, for example, this backhand or those dinks. Anytime that we're excessively using the elbow or wrist, one, it makes our dink or our backhand less consistent, but it also creates more stress on the elbow. We want our stroke to be mostly coming from the shoulder when we're dinking and driving on the backhand, so that we use the bigger muscles of the body, which are more powerful, more resilient, versus the smaller ones of the wrist. So if you're doing dinks like this or dinks like this, this is where we run into problems. Less consistent because we're using smaller muscles. So the mechanics, that could play a role in why your elbow hurts. If that's the case, then I would always refer people out to a coach to look at how you're playing. All right, so we have those three things. I got my two shot up here. We're talking about hip hinge, lunging, and body mechanics, okay? So the hip hinge, that's the first thing. Now, let's just say, for example, we're at the net and we want to hit these volleys or these dinks and be aggressive and put pressure on our opponent. We don't want to be standing like this and be like, oh, I got to get down, right? We want to be ready. So that position, let's just say we're at the kitchen line, we're set up, and I'm leaning forward in this position, and I could get these balls out of the air. This is basically a hip hinge, all right? So from the side view, my spine stays stable. The key is a two-handed rule I usually give people. The pubic bone or the belly button and the sternum. Those two hands or those 2 points should never come together, right? Or you're rounded, or come apart. Hyperextension. So we want to focus on, all right, where is your neutral, and set that two-handed rule. That should never change. So my hip hinge looks like this. I have my feet about shoulder width apart, and I send my hips back, okay? The more back I bring my hips, the more I engage my glute muscles, and the more stable I can be in this position. This is more athletic. This is a hip hinge versus a squat, which is more upright torso and the knees going forward over the toes, okay? So hip hinge is the key. And what I have people do usually, if they have a hard time performing a proper hip hinge, you can grab anything that's straight stick. I got a PVC pipe here, but you can use a broom handle at home. What you do is you take one hand and you hold it with the palm facing out on the small of your back. All right, so I got my fists here holding the stick. It's contacting me at the hips, pelvis, mid-back, between my shoulder blades, and head, okay? So here's our reference point of what is straight. If I'm standing here talking to you, my shoulders, my hips, and my head are touching the stick, this is where my spine is neutral, okay? And then we do the hip hinge. So if I do the hip hinge, all of those points should always remain in contact. If I lose contact with the butt or the mid-back or the head, that means that I've changed my spinal alignment or position. All right, so here's my hip hinge. Once we feel like we can groove this position, setting my hips back, the knees have not gone forward over my toe line, I'm engaging my glutes, then we can get rid of this. And then I could actively kind of do a hip hinge and then do my drills like this. If you're drilling with a partner before you play, work on that hip hinge and working from the shoulder as you're doing these dinks, not from the elbow. Okay. The next movement that we encounter a lot are lunges. All right. If we're going and those dinks are outside of our stance here, we might have to lunge or cross over to get to those points, right? Backhand dinks, or if we're at the net or at the transition zone, we want to get into that split step position, which allows us to be stable and hit the next shot or lunge. Now, we mentioned earlier about knee position. The knees, all they do is bend and straighten. That's all they do. That's all they do. But if I plant my foot on the ground and I want my knee to be bending in the right direction, we talked about alignment, it needs to bend in the same direction as my foot, okay? Oftentimes people will start to plant their foot and bend their knee, and it looks like this. Their foot will be pointing in one direction, hopefully you can see that on camera, and the knee goes in another direction. So here's the exaggeration. And you could start this, you could do this on your own. You're gonna stand up, and then you're gonna try and do a sit to stand or a squat. Now the squat I mentioned is more upright, my knees track in the same direction as my toes. But if I'm here in this position, where are you comfortable putting your feet? All right, let me show my feet more. Are you comfortable like this when we do the squat, or are you like this? Ideally, when we're doing a squat, the feet should never turn out more than 10 to 15 degrees. All right, and then when we squat, it's easier for the knees to track in the same direction as the feet, or slightly out. That would be great if you can bring it out like that. But most often, ankles can limit your ability to do that position. Your ankles can get tight, your calves get tight. So what you do, and I've seen this time and time again, is that people will create a little bit more wider stance. And with the wider stance, the feet turn out. And that lessens the loading or the requirement of the ankle to bend. And then when we do the squat, I'm going to exaggerate here. I know this is going to be uncomfortable and painful, possibly painful for me. We keep the knees inward, and people will squat like this, or they'll go down and then they'll be like, the knees buckle in. If we repeatedly do that, even with a quick step like this, you can see how I step in and I'm doing that quick movement and the knees buckling in like that, then that creates over time how many repetitions that happens, that creates that excessive stress on the joint and the cartilage, and we wear out the joint. How do we control this position? This position right here is hip internal rotation and hip external rotation. That goes back to the glute muscle. If you can control and have a strong glute, then you can control better the knee position when you do lunge or squat. The other thing you want to work on is ankle. The ability for your ankle, I'll show you my ankle. This is basically what we call dorsiflexion, bringing the knee up. If you were trying to do your squat and you're like, hey, I'm going to go down, and then your heels come up, my heels are no longer touching the ground, and you're like, I'm down here. This is a very unstable, unathletic position. I'm precariously balanced, perched on my toes when I'm squatting, which causes me to create more stress on the knee. The ankle and the foot should be flat, and the ankle should be able to get into that dorsiflex position. You can see how I'm moving my knee forward of my foot. And if we can't do this, we lose the ability, and then people will start to squat with the heels elevated, okay? So what I like to have people do is we have to get something to elevate the front part of your foot, okay? The ankle mobility or ankle mobilization exercise that I usually prescribe for people with tight ankles is to elevate the front part of your foot, keep your heel locked into the ground, point it straight, and then you're going to bend your knee as far forward as you can. Now, it's very important how we do this. From the side, you can see that I'm bending my knee, bringing that forward as far as I can. My heel has to stay on the ground. If my heel comes up, then that's a fault. We don't want that to happen. The other thing, looking from the front, or if you're doing this on your own, you're going to be looking down at your thigh. If you set up your foot totally straight, hopefully we got this on camera here, and I bend my knee forward, that knee needs, and the thigh, more importantly, because that's easy to see, that thigh needs to point in the same direction as my foot. Oftentimes people with tight ankles will do this and say, hey, I'm going forward. I'm pushing my knee forward over my toe, and I'm mobilizing my ankle. If you repeatedly do this, and your knee and thigh go this way inside of your toe line, that will create more repetitive stress on your knee, more wear and tear on the joint, and also reinforcing this faulty movement pattern. So every time that you lunge or go downstairs or squat, this is the way that you'll move versus this. And this can be very difficult for people to mobilize. Doing that forward and backward motion, heel elevated. I usually recommend at least a minute to a minute and a half. You can even do that up to 2 minutes daily, okay? Trying to counteract the tight positions of our foot and ankle that we experience throughout the day because our body adapts to the positions we placed it in. So if you're sleeping and your foot's like this 8 hours, then adaptively becomes tight in this position. Then we start to lose this position. All right, so we're going to stretch that out daily as often as you can. The other thing is learning how to squat with the right position of your knee. So once we work the ankle and we have the successful ankle position, then we learn how to squat properly. So again, I'm going to start from the sitting position. You can pick a chair that's higher. Lower chair is going to be more difficult. We want the feet to be shoulder width apart. Again, 10 to 15 degrees of turnout if you can. And then you're going to stand up. As you stand up, what are the first things that happens? We have a tilt forward of the trunk. Remember, two-handed rule. We never want that to collapse or extend. We just pivot from the hip. That gets my weight off of my hip and onto my feet. And as I transition into standing, I'm maintaining the width or the position of my knees in the same direction of my toes. All right, so that's an easy one to kind of do and reinforce this toe, nose over toes actually, and then knees out. From the side view, it looks like this. Feet shoulder width apart, maintaining good spine angle, two-handed rule, feet 10 to 15 degrees apart, turned out, no more. And then we can lean forward and then drive and extend through the hip. This is all glute driven, hip driven. The glute is the key to preventing any knee issues going down the line. All right, so we talked about the hip hinge, how to get that stick, working to be athletic and strong in this position, to either side shuffle, get to those things quick, and also reach those volleys out of the air because you want to put pressure on your opponent. You just don't want to sit back, dink, and then wait for that ball to bounce, because if they push you off of that kitchen line, that's where you're liable to lose points. Either you pop it up or hit it into the net when you're hitting this ball, stepping back, and it's behind you. You want to keep that ball out in front. Again, working from the shoulder with a fixed elbow and wrist versus trying to do too many wrist or elbow movements that creates more stress on the elbow. All righty. So hopefully you guys found that helpful or useful. If there's any questions, you can put them up in the chat here. And otherwise, I'll give it like a 30-second countdown, and then we'll wrap things up so you can enjoy your sunny Tuesday here in New Jersey. All righty. All right. Thank you for joining me today. You can look for this session and many more on demand on any of the Better Spaces apps. I'll be back Tuesday, June 4th for pre-game prep, effective warm-up strategies for pickleball. We're going to be able to get ready to hit the court with confidence by learning effective warm-up strategies tailored for pickleball athletes. All right. In the next session, I'll talk about the importance of warming up before playing pickleball, explore specific exercises, what type of stretches that you need to do, what type of movements that you need to do. Do you just go out to the court, grab your paddle, and start thinking and warming up? No, there's a better way to prepare your body optimally for your best performance. We're going to talk about dynamic stretching, mobility drills, sport-specific movements to loosen up your muscles, increase your blood flow, and prevent injuries on the pickleball match. Okay, so thank you for joining me, and have a great day. Hey, if you have any questions, feel free to email me here at paul@par5pt.com or team@betterspaces.com. Thanks for coming, and be well.